Nice to see
Hello.
you.
You too.
Yeah. Hello, Dr. Hardeep Sandhu. Nice to see you here.
We are live on YouTube now.
Okay. Can you start the slides, Amrita? Yeah.
Hello and welcome everybody. I hope you all are doing well today. My name is Shraddha Utekar, your today's host. I work at IPA admin office based in India as project manager for IPA Vaccine Trust project. On behalf of IPA and all, I welcome you all again to the launch event of IPA Vaccine Trust online course and IPA-Sabin Vaccine Institute collaboration. So without any further ado, I welcome Dr. Errol Eldon, President of IPA, for his opening remarks. Over to you, Dr. Eldon.
Thank you very much. Good morning, good afternoon, and good evening. I'm Dr. Errol Alden, President of the International Pediatric Association. The IPA is a 110-year-old global body representing and connecting pediatric professional societies all over the world. Our goals are to address the needs of children and neonates to ensure that accurate information is available to both the professionals and the public, so every child has the access to the highest attainable standards of health, the opportunity for optimal growth and development, and the ability to fulfill their potential. The only proven effective method for the advancement of civilization is the care and education of our children. At present, the IPA represents 1 million pediatricians devoted to the well-being of every baby throughout the world. As you all know, healthcare professionals play a critical role in immunizations. The arrival of COVID-19 has magnified our attention to vaccine confidence and acceptance. There are 15% fewer children immunized in 2020 as compared to 2019. Our role becomes more prominent in training healthcare professionals to advocate for vaccinations and increase vaccine compliance. At this critical time, the IPA is launching a Vaccine Trust online course on the IPA Learning Management System. The IPA Vaccine Trust course will be available in 6 languages: English, Spanish, Russian, French, Turkish, and Portuguese. The IPA Learning Management System will be the platform for many more courses in the near future. I am particularly delighted to announce that the Sabin Institute is collaborating with IPA's vaccine project to train healthcare professionals in communication and advocacy skills for promoting immunizations primarily in the 7 Gavi transition countries. I extend my appreciation to Dr. Naveen Thacker, the IPA Executive Director and Project Director, Dr. Walter Ornstein, Co-Chair, IPA Immunization SAG, the Project Advisory Group, and the Vaccine Trust Project team for their tremendous efforts and work to make this project and collaboration a grand success. I now invite Amy Finan, CEO of the Sabin Institute, to make a few remarks. Over to you.
Good morning, and thank you very much, Earl. And many thanks to everyone around the world for joining us today. I know we're really weary about these virtual events, so we appreciate you taking the time to join us. Today is really about the content developed by colleagues IPA has gathered worldwide to assist frontline health workers of all cadres in navigating the gauntlet of information that's really being thrown at them, literally, about the COVID-19 vaccines, by also ensuring that patients are continuing to receive their routine immunizations on schedule. And this is in the face of increasing information and disinformation. So just a few words about the Sabin Vaccine Institute and why we're thrilled to partner with IPA. I'm sure most of you know our namesake, Dr. Albert B. Sabin, who's really best known as the developer of the oral polio vaccine that saved millions of children worldwide. But what a lot of people don't know about Dr. Sabin, he was really one of the first global health advocates. We like to say that he was a global health warrior because he traveled around the world and campaigned against poverty and ignorance to ensure that all children everywhere had access to his vaccine. So the Sabin Vaccine Institute was founded in 1993 here in Washington, D.C. to carry on Dr. Sabin's legacy by advocating for expanding vaccine access and uptake, advancing vaccine research and development, and also amplifying vaccine knowledge and innovation. The centerpiece of how we work at Sabin, though, is all about partnership and community building. Whether it's partnering to advance R&D on vaccines with little commercial value, like Ebola and Marburg disease, or stoking innovation of high impact global health solutions like our Universal Influenza Vaccine Initiative, or building our global community of immunization professionals that we call BOOST, or following Dr. Sabin's lead by working with partners to ensure that communities around the globe are better informed about vaccines and immunization. Which really leads us back to why we're here today and why we're partnering with IPA to elevate their new Vaccine Trust Project, which is aimed at addressing the most important gatekeepers of vaccine and immunization information, the frontline health worker who's directly communicating with the patient or in their family. But before I wrap up, I just want to make clear that this project is the brainchild, so to speak, of IPA, its members, and the many experts who advise on it. Sabin's Immunization Advocates Program is delighted to partner with IPA on vaccine and immunization communications and advocacy specifically for health workers in 7 countries in Eastern Europe and Latin America. As Earl said, those countries are already facing challenges of transitioning from assistance from Gavi, the Vaccine Alliance. And so I'm excited to hear from the frontline leaders in many of those 7 countries on our panel today and what they're actually facing in their countries. I'm also thrilled that IPA designed this project and has explicitly encouraged frontline health workforce teams involved in immunization to learn together and from each other, from pediatricians to nurses to midwives to pharmacists to community health workers. We all need to come together to be successful. Thank you once again, and I think I'm supposed to pass it back to Naveen.
Yeah, so Robin, over to you for opening remarks. Dr. Robin Nandi is a principal advisor and the chief of immunization at UNICEF, and he has been very supportive of this project from day one. Robin, over to you.
Thanks, Naveen, and thanks, Errol and Amy. It's good to see everybody. It's good to be here at the launch of this event. I see a lot of friends and colleagues on the participants list, and really happy to be here with you. This is a really significant moment, and I really want to congratulate the IPA for their leadership in co-creating this training package, both online and offline, and digitizing it, making it easily accessible, translating it into a number of languages. I think just to add on to what Errol and Amy started off with, I think this is really going to be a critical piece in the puzzle in terms of improving vaccine uptake and acceptance. For the longest time, we actually separated, supply side and demand side for immunization, and it was extremely technical and medicalized, and the assumption that if you provide services, people are going to come and receive the services, with probably less emphasis on awareness, communication, the way we communicate, the way we interact with our beneficiary population. And really happy to see in the last several years the divide between the supply and demand side getting closer and moving from medical science to also incorporate behavioral science in the way we work. The importance of this training package and the way we communicate with our beneficiaries to improve the uptake of vaccines has already been mentioned. But I want to try and situate this into the big picture, and I think this is a critical piece of an overall puzzle to improve trust in the system. A lot of talk these days is about vaccine hesitancy and how people need to be convinced to take a vaccine. But I think it's important to situate this in a broader environment of trust in the system and trust in the health system. What I'm getting at is the way we deliver the services, the quality of services, the way we communicate about them, the way we are able to convince our beneficiaries, the overall quality of care that we provide is extremely critical factor in whether people come back or trust the services. And this is even more so today in the context of the COVID-19 pandemic, where there's been an erosion of trust in the overall health system, the overall scientific system, and we need to get the trust back to deliver not only vaccine, but a broader range of essential services. So I think the IPA is a really powerful voice and a really powerful network in order to get the trust back in the system. And I just want to end by saying what a pleasure it was to work in this multi-agency initiative involving Gates Foundation, CDC, Sabin Institute, Emory University, Gavi, the Vaccine Alliance, WHO, Johns Hopkins, JSI, USAID. I'm sure I missed a number of people, but really appreciate the contributions of all to getting us to where we are now. Thank you. Back to you, Naveen.
Thank you, Robin. Thank you very much. Now I invite Dr. Walter Orenstein to speak about the course and Sabin collaboration. Walter, you are, go ahead.
Thank you very much. Welcome and thanks to the Vaccine Trust Project Advisory Group, or PAG, the members and the faculties. I'd like to talk a little bit about the IPA Vaccine Trust Project. As has been mentioned, vaccine hesitancy, as little as last year, was listed as one of the top 10 main threats to global health by the World Health Organization, alongside air pollution and climate change. Vaccine-related misinformation, scaremongering from the anti-vaccine community is especially relevant in this COVID-19 era. The vital role of healthcare professionals are the cornerstone of public acceptance of vaccination. Most pediatricians and medical professionals are not trained in communication approaches that can build trust, pass on standard messages to build vaccine confidence, and identify strategies to address vaccine hesitancy. The importance of effective communication is a priority component in WHO's COVID-19 roadmap to enhance trust and enable the public to make informed choices based on scientific recommendations. There are three major activities planned under implementation of the project. First is online training on Vaccine Trust course, level 1, and an IPA learning management system. Number 2 is the Global Vaccine Trust Leadership Forum. And number 3 is doing surveillance to detect vaccine information and develop responses. The IPV Vaccine Trust online course on IPA Learning Management System is a course that aims to increase and utilize communications and advocacy skill sets of healthcare professionals providing or promoting vaccines and immunization. The course consists of 7 modules and 2 living learning modules. The intended participants are pediatricians, nurses, community health workers, program managers from the public sector, and others. The course will be available in 6 languages: English, Spanish, Russian, French, Portuguese, and Turkish. Members can visit the IPA website, which should be coming up in your chat, or to register for the course, or for more information related to the course, they can also write to an email address, which again should be coming up in the chat. I'd like to also really thank the Sabin Vaccine Institute for being willing to collaborate with the International Pediatric Association for targeted activities utilizing IPA's new Vaccine Trust Project online education program for health worker communication and advocacy. The collaboration includes priority enrollment and training of providers in 7 Gavi transition countries in Eastern Europe and Latin America: Armenia, Azerbaijan, Georgia, and Moldova, Bolivia, Guyana, and Honduras. It includes communications and advocacy activities and seminars aimed at increasing frontline vaccine providers' communication skill sets and resource access. I'd like to move to a transition to the panel, and I invite Dr. Naveen Thacker and Ms. Vince Blazer to come on now, please.
Thank you. Vince, over to you.
All right, great. Thank you so much, Walt, and thank you everybody for joining us today. My name is Vince Blazer, and I am the Director of the Immunization Advocates Program here at Sabin and at the Sabin Vaccine Institute. Really thrilled everybody could join us today. So we're getting into the panel here. The topic of our event today is vaccines and immunization perspectives from frontline health workers in low and middle income countries. And as Walt mentioned, the seven Gavi transition countries in Eastern Europe and Latin America already before COVID-19 were facing a position of trying to create a sustainable immunization program as they transition off significant assistance for their immunization programming from Gavi, the Vaccine Alliance. That transition already comes with some difficulties and challenges, and so and we already see a lot of this rise of misinformation and disinformation as that transition was happening. Now add COVID-19 onto that and all of the disruption it's caused, plus now all of this information for vaccines and immunizations. So we're really, really thrilled to hear from country leaders of these 7 countries that Walt had mentioned. They're frontline pediatric leaders from each of these 7 countries. So I'm going to invite each of them for a couple of minutes to share their perspectives of what they and other pediatricians and health workers are seeing in their countries in terms of conversations with their patients on vaccines and immunization, and what type of communications and advocacy skill sets would be helpful for their members to have going forward over this next year. So we're going to go in alphabetical order. The first country is Armenia, and I would like to invite, and I apologize in advance if I mess up anybody's name, but like to invite Dr. Sergei Sargsyan from Armenia for the first comments. So Sergei, to you.
Thank you, Dr. Blazer. Pronunciation was absolutely good. So many thanks from Armenia on behalf of Armenian Pediatric Association for this, and overall from Armenian pediatrics and for this initiative. And of course, we have to tell that immunization is always on our agenda. And frankly saying, of course, I have to tell that last year, it's as everywhere, the process is a bit worse, but a bit, not much, than it was before COVID era. And of course, before it was enough high level and among the highest in the region, in our region of European region. So thanks to efforts of Armenian pediatricians, thanks to efforts of our colleagues from Gavi, from UNICEF, from WHO, and thanks to our parents, our families who trusted us to do it. But anyway, let's say frankly that why I believe this initiative is in time is that I'd recommend the bicycle, but let's tell that frankly that communication skill is not one of the best parts of many health workers' work style, I would say. Maybe they're very right in diagnosis, maybe they do good auscultation, but anyway, sometimes overall communication skill is not always the best. And therefore, improving communication skill always was our and my personal, feeling that we have to tell our doctors to work better in this line. And especially nowadays, when we speak about nowadays, when we have infodemics, when we have other sources of information. For instance, if think for 100 years ago, source of information was maybe some nurse and maybe some other older opinion maker in community. Now sources of information are multiple, and this makes things difficult for parents and difficult also for doctors. Therefore, to find the best ways to reach minds of our caretakers is important for all kinds of medical work and for immunization especially. Therefore, why I value very much this event. So therefore, I thank you again. And the last, not least point, we have to think also about young doctors, because we older doctors, we met many cases, not many, but anyway, cases of diphtheria, measles, and we understand why it's bad. But nowadays, maybe they don't see much it. Yes, and don't believe that it's so problematic and so important to do. So overall, many thanks and good luck to everyone. Thank you.
Go ahead.
Yeah, so thank you very much, Dr. Sarji. I will invite now Dr. Rob Butler, Executive Director of the WHO Euro. He has contributed to the first module of the course, Behavioral Science Behind Vaccination, along with Saad Omar. So let us, Rob, Dr. Sarji has already raised some points, and we would like to hear from you, your perspective. What do you feel, how much, behavior science, the focus on behavior science now? Anything you want to say about the module or course?
Naveen, thanks very much. I wasn't expecting the floor. I thought we were going to hear from the countries first, but I'll take it now you've offered it. Thanks very much for having me. Great to see Errol, Amy, Robin, Walt, Naveen, thanks, and Sergey just now. I love the look of the course. I'm very excited about it, and really congratulations to IPA for the leadership on this. I was engaged in the very early days and not so much recently, but maybe just to hear from where I'm sat in the WHO European Regional Office, this trust element is possibly more today than it's ever been in the past. Because we have seen a correlate between trust and the success of the pandemic response in the European region. And we've been at the epicenter for the large part of the last 9 months of this pandemic. We have seen that adherence to measures and policies that have been put in place are very much correlated with the levels of trust that we expect in each country. Higher acceptance for vaccines also is associated with a level of trust, as we've seen from the 27 or so behavioral insight studies that we've conducted in the member states in the European region. So I wanted to say that the frontliners that are going to sit on this course and undertake this course. And hopefully we'll see people from the health sector, but hopefully we'll also see people from the social sector. And when I talk about social sector, I'm talking about frontline social workers in care homes, old people's homes, nurseries, who where we saw a huge burden over the last 9 months in terms of the pandemic. So trust, I feel, if I can just sort of say, that we're going to be tested as public health communicators in ways that we've never been tested before in this next year. With a vaccine, let's say a scenario of 95% effectiveness, with our middle-income countries and low-income countries having the possibility to at best vaccinate 70%, 60-70% of their population before the end of 2021, with, let's say, an 80% acceptance and a 10% dropout, we're not going to have direct protection of populations above 50% in most of our member states in Europe. So the communication challenge is one that it has to look to building trust, not just in the way in which we communicate who gets the vaccine first and how we're going to communicate around the priorities and the priority populations, but more importantly, how we're going to get people not to throw their masks away just yet and to understand that the physical distancing measures in our region are going to have to stay throughout the next year as we try and build this herd immunity and as we try and vaccinate more of the population. This is probably an unprecedented communication challenge, but at its heart, at its very heart, is trust. And if we can elicit that trust from our frontline workers, from our frontline, our most valuable, heroic frontline, then that's a great starting place. So I just wanted to say a big vote of thanks and from the regional level for this piece of work, and congratulations to IPA and to all the partners that are on board here and the countries particularly as they take this forward. Thanks for giving me the floor. A nice surprise.
Thank you, Rob. And that's why our name of the project is Vaccine Trust Project. Yeah. So Vince, over to you.
All right, great, and thanks, Robin. I think that's a good compliment to Sergey's comments that trust. Nobody trusts has higher trust for than the frontline health workers for health information that patients receive. But Sergey's point of being empathetic and having those communication skills to have empathy of understanding on these questions that are being raised in vaccines, and how to not just how to answer them clinically, but how to communicate with patients is really important. And so moving on to the next country on our list is Azerbaijan. And Dr. Fakhriya Mamadova, you are up to tell us a little bit about what you're seeing in Azerbaijan. So over to you.
Thank you, Vince. Dear colleague, first of all, I want to express my gratitude to International Pediatric Association and the Sabin Institute for organizing this event and for invitation. Thank you very much. And about the problem, anti-vaccination movement, has always been present, but in COVID-19 pandemic era, it reached its heyday due to a lot of conspiracy theory, a lot of non-objective information in the social networks, in the internet sources, etc. Unfortunately, this problem is quite urgent in Azerbaijan as well. And I want to say that the government of Azerbaijan is making the early efforts to combat the COVID-19 problem. So the new medical structures have been created, the international experience is used. And as you know, at the initiative of the President of Azerbaijan Republic, Mr. Ilham Aliyev, who is current chairman of the non-aligned movement, at the new session on December 4th, the session of the General Assembly dedicated to the fight against COVID-19 was organized. And at this event, the importance of the equal, it's inherited, and for all countries, equal for all countries, especially low and middle income countries. So medicines, vaccines, and the medical requirements is emphasized. So about Azerbaijan is also developing the vaccination strategy. It should cover at the first stage approximately 20% of all population, primarily the health workers. And first, Azerbaijan, as the whole world, is waiting for real proven and safe vaccines against the COVID-19. So in the era of the pandemic COVID-19, the Azerbaijan Pediatric Association, it's about the organization of to maintaining the normal immunization is increasing the informational influence on parents directly at least or indirect due to further international sources, social networks, and we hope for cooperation and exchange the experience between countries, especially in the framework of the International Pediatric Association and the Sabin Institute collaboration project as an organization with a great experience in this field. Thank you very much for the attention. That's all.
Very much, Ms. Mammadova. Really appreciate it. So we're going to be going now from Eastern Europe over to Bolivia and Maria Trujillo, and I believe that Dr. Rodriguez from the Costa Rica Pediatrics Association is going to help translate. And so we are very interested from Dr. Trujillo to hear from you on what some of the conversations and what you're facing with conversations with patients on immunization in Bolivia. Dr. Trujillo.
Mariel, doctora Trujillo, preguntan por su participación.
You are muted, Dr. Mariel, you are muted. First, unmute yourself.
Me tocó hacer la consulta hoy día. Un saludo caluroso desde Cobija, Pando. Bolivia es uno de los países en favor del bienestar de la niñez. La preocupación por la infancia cobra cada vez mayor conciencia en el mundo, dada la persistencia de miles de defunciones diarias, la problemática de salud infantil como una prioridad que requiere la atención inmediata, así como por los efectos negativos que tienen los indicadores de salud. Se debe de redoblar necesariamente esfuerzos para garantizar esta cobertura de inmunizaciones que nos están proponiendo. En nuestro país vamos a colaborar con eso para incrementar la disponibilidad de información y orientar a las familias a que complementen el esquema de vacunación, sobre todo en las comunidades más aisladas y vulnerables. Asimismo, el trabajo coordinado de los sectores privado, social, como es el caso mío, y público es fundamental para reforzar la cultura de la vacunación y posicionarlo como un tema prioritario para la salud y para la seguridad de nuestros pequeños. Todos debemos contribuir para asegurar que la cobertura de vacunas llegue al 100% de niñas y niños del país, garantizando la calidad, accesibilidad y oportunidad para la vacunación que tienen estos niños. Y sobre todo para hacer que sobrevivan y disfrutar de la salud con calidad para nuestros pequeños. Muchas gracias. Thank you.
Dr. Julia, can you interpret? Yes.
Yes, Dr. Mariel, thank you very much. Muchas gracias. She says that Bolivia is very worried about all the suffering from the disease, the pandemic situation, all the disease they have, and the preoccupation of the worrying about the children's situation. They have been working in information, trying to raise the coverings of the vaccine programs to give the best for their children and informing or advising the parents and families about the importance of the vaccines. They are working in this, trying to do the best to cover, protect the children because of their situation with the pandemic, with the virus there. So they are working in that, informing the families about the importance of not letting other diseases to appear because of lacking of vaccines program. So they are encouraging population and families to be aware of this situation. So that's mainly what she said, Dr. Trujillo.
Thank you. Thank you, Julia.
Okay.
Thank you. Yeah, thank you, Dr. Fernandez, and thank you, Dr. Trujillo. Very, very interesting comments. And as we transition back over to Eastern Europe and Georgia and Dr. Guetta, I just wanted to encourage anyone who has any questions for any of these leaders or for anyone who is speaking to use the Q&A function, and then the chat function won't be monitored for questions. So use the Q&A function on the chat for questions. And Dr. Guetta, as we come to you, interested to hear what is happening in Georgia and kind of how it relates to what some of your other panelists have shared so far. Over to you.
Good afternoon, dear colleagues. I am Dr. Ekaterina Getia. I am representative of the Association of Pediatrics from Georgia. I am very glad to see everyone. To cut the long story short, the challenges vaccine in Georgia. Georgia is actively involved in the implementation of the European Regional Action Plan. The plan is developing the base of the global action plan of vaccines, and its purpose is to eliminate or eradicate the contagious infection with the help of vaccination. National immunization program achievements in our country is supported by the fact that funding of the NIP increasing significantly during last 6 years. The comprehensive multi-year action plan for immunization from 2017 to 2021 adopted following the main goals of the European Vaccine Action Plan. Globally, given the pandemic and epidemiological situation, many countries have faced a wide range of problems caused by exceptional situation, and they differ from each other's scale, complexity, and international consequences. The amendment was made in the law of Georgia on health and was determined the list of obligatory prophylaxis vaccination. It has become mandatory to present a document confirming immunization status at the start of the studying or the child care process. Nowadays, one of the greatest role plays social media and the possibilities which are given to the parents sharing their own opinion, although negative statements, and we should do our best to protect the healthy mind and give them good advices. And finally, in the current situation, the continue of the immunization process is very important, which guarantees the prevention of possible exacerbation of the epidemiology or manageable infections in the future. And thank you very much. And I have for all colleagues one question. Could you share your mind about COVID-19 vaccine in pediatric patients? Thank you very much.
Thank you, Dr. Gaete, and that's a certainly great question that would be great to have when we get to some of the respondent panelists to discuss the COVID-19 vaccine in pediatric patients. I also really appreciate that you raised the issue of social media and social media channels, and really the importance of health workers and across the health workforce team engaging in social media, but doing so to to explain and comprehend all of the information that people are receiving and helping people understand it. And the IPA course does have a module on trying to help health workers try to navigate how they can best engage on social media. So going over now to Guyana, we have Dr. Mutu from Guyana. You're welcome to share your perspectives.
Thank you very much, Vince. My name is Malika Mutu, and I am from Guyana in South America. We are the only English-speaking country in South America. First of all, I'd like to take this opportunity to thank the National Pediatric Association and the Sabin Vaccine Institute for the opportunity to participate in the Vaccine Trust online program. It was a tremendous program. I learned so much from the few days that I spent listening to those presentations and lectures. Thank you so much. I would highly recommend this course to anyone. So in Guyana, we have always had a very good uptake and reach of childhood immunizations. However, in 2020, we faced some challenges, and this was, of course, because of COVID-19. Our Ministry of Health's Maternal and Child Health Department worked assiduously to try to address some of these challenges. And the challenges were centered around people trying to stay at home, not come out in public, not be on public transportation because of fear of contracting COVID, and also because of some of the measures that were implemented for the safety of the public. One of the things that the Ministry of Health implemented was calling people to have them come at appointed times for vaccines so as to not have them cluster in the clinics. Even so, some people were very hesitant to come out. The ministry then implemented a plan where they went door-to-door, a door-to-door campaign to actually encourage people to come out and be vaccinated, have their children vaccinated. And in some cases, in some of our smaller villages, they actually went door to door and gave the vaccines to the children so that they wouldn't actually have to come out and get and be vaccinated, come out into the public and get public transportation. Another thing that they implemented, started having fortnightly or meetings with the frontline workers in all of the outlying villages and areas so that they could address any of the challenges that they were facing and any of the problems that they were having. This proved to be very successful, just being able to meet people at the level of where they were, what were the problems, and how they could be helped. Also, the ministry has undertaken using television, radio, and social media, since that seems to be the go-to way of spreading information these days, to try to get people to understand why it was important that children were vaccinated on time, that even though we were facing a pandemic, we did not want to have a double pandemic by having other epidemics within the country. So we've used that to our benefit to try to get messages out to the public. It is an ongoing process. We are trying all the time to make sure that our children come in for vaccines. And of course, now we're facing, on a larger scale than we've ever faced, some amount of vaccine hesitancy surrounding the vaccine. And that, of course, as everyone knows, is because of all of the information that is out there, misinformation that is out there on social media, all of the conspiracy theories about COVID-19 itself, and also the vaccines. We have started preparing for the vaccines. We've started getting cold storage in place. We live in the tropics, so having to get vaccines at minus 70 degrees is, of course, going to be a challenge. And of course, trying to get messages out to the public, trying to make them understand why this is, one, a real disease, and two, why this vaccine would be of great help and importance to the general public. Again, this will be an ongoing process. I will be happy to use some of the skills that I have learned on this program to try to help our Ministry of Health. Thank you.
Thank you, Dr. Mutu, and really appreciate you raising some of the issues that you did. I think it's those door-to-door communications. I know in one of the comments it was also raised to community pharmacists, that so many people having these interactions, that it's very important to kind of pass down those skill sets and have those meetings of the frontline team, pass along those skill sets. This course was really designed so you know, for a multitude of providers to be able to go through this course, and so we're really pleased with that. And of course, pediatricians, you know, being leaders of these teams. And you also mentioned the TV radio campaigns in Guyana. There's also, we've also really seen during COVID-19 how important it is, not just for ministry officials, but for public health officials and health workers to speak to the media about, whether it be local media or national media, on vaccines, on other issues of COVID-19. And so this course helps get at that as well. So we'll now go over to Honduras and Dr. Lara for her perspectives, and thanks to Dr. Fernandez again for interpreting. Dr. Lara.
Yes, you are muted, Dr. Lara. Dr. Mirza, you are muted. Unmute yourself.
Okay, sorry, I have a problem technical. Okay. Bueno, mi participación será en español. La doctora Julia Fernández hará la traducción. Haré por momentos la espera para que ella traduzca en el momento. Pues nuestra situación en Honduras, así como de muchos países que estamos escuchando, hemos tenido muchos problemas en cuanto a al tener una salud estable en los niños, porque se nos han venido muchos problemas ambientales, de conocimiento de ustedes que los dos huracanes que hemos tenido nos han venido todavía a ser más inestable nuestra cobertura de vacunación, que este es el motivo de este webinar, ¿no? La cobertura de nuestro país, como otros países, no nos hemos quedado atrás. De un 95% que teníamos en cobertura infantil se está dando, ha bajado con tantos problemas ambientales que hemos tenido, los huracanes, más todo la pandemia. Eso ha venido a disminuir los casos de la cobertura nacional de vacunación. Pero ante este reto no nos hemos quedado atrás, y nuestro país, a pesar de muchas limitaciones que tenemos, las coberturas de vacunación se han ido presentando de una forma casi sostenida y aceptable, ¿verdad? De 95% que estábamos en cobertura, estamos ahorita casi llegando al 85, 90 en cuanto a la cobertura general de vacunación. El tema de la vacuna del COVID, ese es también otro problema que hemos estado teniendo, porque aparte que somos un país en vías de desarrollo, se nos complica un poco lo que es la cobertura nacional y poder garantizar esta vacunación a todos todos los habitantes de nuestro país. Igual estamos en espera, como muchos países de ustedes, en vigilancia y también en ese desafío de poder cumplir con los estándares internacionales de esta cobertura de vacunación. Sabemos que puede existir un brote ante todo este paro de vacunas que se detuvieron durante la pandemia, que se están teniendo, perdón, por motivos de que mamás les da miedo salir a vacunar y ellos prácticamente no han cumplido con su deber de llevar a vacunación a los centros de salud a los niños, ¿verdad? Entonces, hemos estado haciendo desafíos y líneas de acción implementadas durante la pandemia. Así que, doctora Julia, le doy su tiempo para traducción en este momento y sigo un ratito después.
Dr. Fernandez, you are muted. Unmute yourself. Julia, unmute yourself.
Yeah, thank you. Sorry, Dr. Lara, as well as Dr. Trujillo, say hello to everyone. Dr. Lara made remarks about the situation that they have recently with the 2 hurricanes in their country. And this has been created more difficulties for the vaccine applications. People are reluctant to go to the health centers for vaccination because of also the pandemic and the access to the health center because of the damage of the natural disaster. She said that they are working and very worried about the situation, and the vaccines covering has dropped a little bit from 95 to 85, and they are trying they're working against this dropping, encouraging people to go and vaccine their children. And also she's worried about the complication with the covertures of the vaccine of COVID-19 because of these emergencies as well. And they are trying, it's a challenge to make people to go and vaccines and keep the numbers up again. So they are working hard in that. No sé, doctora Lara, si tiene más comentario.
You are muted. Lara, you are muted.
Aquí, sonido.
Unmute yourself.
Okay, thanks. Por último, ante ustedes, representantes de toda Latinoamérica y del mundo, queremos decirles que estamos con estos desafíos y con las líneas de acción implementadas durante la pandemia. Entre ellas se implementaron reuniones estratégicas y tácticas del fortalecimiento y recuperación de coberturas de vacunación en el contexto de la pandemia. También las campañas de vacunación a nivel nacional para promocionar que los papás lleguen con sus niños a vacunación. También se han hecho reuniones con los líderes de cada comunidad y gestiones ante entes cooperantes como la OPS, OMS, UNICEF. Y una participación como país representando el desarrollo de estos programas ante todos ustedes para que vean que no nos estamos quedando atrás y queremos estar al 100% cubriendo la campaña de vacunación y cubriendo la salud de los niños de Honduras. Esta es mi participación y les agradezco a todos por su audiencia.
So at last she said that they are creating action lines and strategies to meetings with local leaders and government and international organizations to create and encourage these campaigns of information and vaccination for the children. And she having the representation of the Pediatric Association, also thanks all of this group to encourage this campaign and to participate in groups like this, and I think also that being the from the Central American region is very important to show us to the world. So we are dealing with big problems, economic and natural disaster and economic restrictions. So we are very pleased to be included in this team, in this group. Gracias, Doctora Lara.
Thank you, Dr. Lara, and thank you, Dr. Fernandez. I really, it's so difficult what what you're facing there with the hurricanes, and then, and so that communication skills of trying to have communities believe that the vaccines and immunizations are an important emergency service within everything they're facing. I know is a major challenge, and so we really appreciate you sharing that. And any way we can be helpful, that we would be happy to. And thank you for sharing that. So we have last but not least is over to Moldova in Eastern Europe, and Dr. Stasi. And Dr. Stasi, I know that there are many nurses interested in this course in Moldova. And so just also interested to hear how you're engaging other cadres of health workers in talking about this issue. So Dr. Stasi.
Hello, I want to greet everyone here at the webinar. I'm very great and very happy to meet my colleague here from International Pediatric Association, from WHO, from my colleague pediatrician here. Traditionally, immunization was state national on the national level and was controlled by high level and the state. Even 40 years ago, I worked as at primary health level, and coverage of vaccination was around 90–95%, as now. In some vaccination coverage is high in Moldova. For example, anti-TBC, BCG is 95, pertussis, the diphtheria is 95, around 90 is measles. Vaccination is dealing in Moldova according with vaccination European action plan, and in a very close collaboration with the European WHO, World Health Organization, and UNICEF. United Nations Development Program is usually provided vaccine here, is buying for state and the provided vaccine. And that's why trust in vaccination and population is okay with trust in vaccination, the quality of vaccination. And during the pandemic in Moldova, not many countries, but Moldova stopped to routine vaccination during 2 months. And since 17 May, it was decided to provide the routine vaccination, and is doing according with a new guidance was issued by European region, WHO European region, guidance on routine immunization services during COVID-19. And we are making according with these recommendations. And of course, communication is very important, especially in Moldova is not trusting influenza vaccines. It's low trusting, even some medical workers is not vaccinated in spite of the vaccines is deployment now in Moldova is making 2 types of vaccines. And some people was vaccinated, some refusing this vaccination. About COVID-19, we haven't yet at the national level this vaccine, only in collaboration with the European region, this European community, we will make this plan. Not yet Communication. Communication, of course, Facebook is very big challenge of communication against vaccination. Some direction is coming to Moldova during this, but people trusting usually in routine vaccines. And education is based on our pediatric department of Ministry of University, Medical University, but providing and implementing the program is is on the shoulder of family doctors. Family doctors is providing vaccination in Moldova, but they are teaching by pediatrician at the pediatric department for continuing education. And we're providing this plan and training courses for them. That is in short.
Thank you so much, Dr. Sasi, and thank you for raising that. We have a lot of work to do to ensure trust in all of the vaccines and immunization programs among some health workers themselves and some health providers themselves. So I really appreciate you sharing that. Naveen, we have concluded all of our country leaders, and so back over to you.
Thank you, Vince, and all the country leaders. And now I request all our PAG members and the faculty to switch on their video, and you can have a look at the question answer. And maybe I can start with Angus, my dear friend, and the architect of this project with me. He taught me first basic, when I was designing this with Dorothy, then he was the person who first taught me basics of the, behavior science and all that. So Angus, over to you for very brief comment. Any question answer, any questions you want to pick up from the chat box or from the issues raised by the country representative?
Thank you, Naveen, and I will be quick. And what a delight it is to see your vision that we discussed so many years ago now come to fruition. I remember early on, we decided to change the name of this initiative from vaccine hesitancy to vaccine trust. And what we've already heard is that this was by far the best decision we made. We know trust is the bedrock of vaccine acceptance and uptake. In the context of this pandemic, with the uncertainty, the anxiety, when public health is on the news, is on the political agendas, when we have this storm of misinformation, trust becomes even more important. In fact, I have recent data that suggests in adults who will be our first targets for the COVID-19 vaccines, trust is more important than vaccine-specific questions that they may have in terms of their levels of acceptance of vaccination. And the participants have one of the IPC courses, the AIMS course, that I was so fortunate to develop with the brilliant Professor John Parrish Sproul. In that training course, we deliberately from the beginning focused on getting the participants to focus on trust. So the outcome of those conversations that we train participants to have is not vaccination, it's increased trust. And in doing so, what we equip them with is the ability to move from one of the most trusted, probably the most trusted voices in vaccination and more broadly public health that any member of the public would have access to a trustworthy voice. And so I think it's terribly exciting now to see this full package available to frontline health workers, to all health workers around the world. And I do hope that we'll see around the world health workers starting to become those active, galvanized, trusted and trustworthy voices speaking up on behalf of vaccines, supporting people in their decisions, and ensuring that our programs, our routine immunization programs, stay safe, and that our new vaccine introduction programs are successful. Thank you.
Thank you, Angus. And I know it's early morning for Margie, so I think I will It's maybe 2 a.m. there. So Margie, I think you can, nobody will mind if you go first now.
Thanks, Naveen, and it's a pleasure to join you all. I'm Margie Danchin. I'm a paediatrician from Australia, and I've also been one of the Vaccine Trust PAG members. And I've been delighted, particularly for this training program, to work with John Paris-Sproul and Angus Thompson on the vaccine communication module. And I just want to echo what Angus was saying, the importance of effective vaccine communication. I personally work in a specialist immunisation clinic at our tertiary Royal Children's Hospital in Australia, and have been having conversations with highly vaccine hesitant parents for over 15 years, as many of you have, I'm sure. But just to say, these conversations are hard. So I think to have a framework and an approach that is outlined, such as the AIMS approach, really gives all healthcare providers the opportunity to have an approach to these conversations. People don't have lots of time, so to make them efficient and effective, you can influence, the outcome for the child in front of you, but also many children in the extended family. So I think this is really exciting, and just to obviously echo the importance of building trust through effective vaccine communication for COVID vaccination, of course, which is going to be an extraordinary challenge in the next 12 months or so. With every vaccine safety signal that occurs with any of the vaccines, it's going to not only impact the COVID vaccine program, but potentially routine vaccination. So we have an enormous job ahead of us in terms of maintaining trust, building trust, sustaining trust. And I think this is an exceptional start to doing that. So thank you, Naveen. It's been a real pleasure to be part of this, and I really look forward to people's feedback on the course.
Thank you, Margie. And I think we are still when, I maybe go by the module wise. So Professor John, it's always pleasure to listen to you, but here, because of time restriction, we will be, just listening few words from you. But I think people will listen to you on the course. Professor John Paris. Yeah. Yes, Professor John. You are unmuted. So go ahead. Can you hear us?
Hello?
Can you hear us? Yes, please go ahead.
Okay. Thank you very much. I'm always a bit slow because my hearing's always 2 steps behind where it needs to be. I want to echo what my colleagues have said, that it's that I see that trust is extremely important. We live with a lot of misinformation and disinformation, and putting information out there, if that were enough, we wouldn't have to have this kind of conversation. But the question is do people trust the source of the information that they have more than the other sources of misinformation and disinformation? When they trust that source, then they're more likely to accept that information and to go ahead and get vaccination. We build trust in communication, or we can destroy trust in communication. The science that supports this is very clear. And I think the program gives a good way of helping you to develop the ability to have the kind of conversations that you need to develop the trust and build on the trust that you already have, and develop the kind of trust in the information you're going to provide so that people can proceed to get vaccinated and to have their children vaccinated. I'm not a physician, but I know that physicians have a lot of knowledge, and they have a lot of skill, and they have a lot of ability. And I like to think of practicing medicine as art built on a foundation of science. And really what the AIMS approach does is it takes the science and it helps you to develop the art so that it can augment the skills and abilities you already have. And so I really hope that you find the modules useful. Like with Margie, I really want to hear the feedback, because all of this is designed to really help you help others in ways that are even greater than what you already do. And so thank you very much for all of you out there working on the front line to get people vaccinated. We need all the help we can get.
Thank you, Professor John. Dr. Suleiman Malik, we have another module in our course from IPCI. Dr. Suleiman Malik from UNICEF.
Thank you, Naveen. Can you hear me?
Yes.
Yeah. Thank you. And thank you, everyone. I went through the questions, answers, and also the chat. And I think there are very good remarks, very good comments, and there are some oral questions for the overall course. I would touch three things. One is that this course and this whole learning program is not only for frontline workers, but this is for the healthcare providers. And we have seen there is enough evidence, especially in middle income countries and recently in Romania and other places where I was also involved, that many middle level healthcare providers, they also lack these skills. So I think this course is relevant for almost everyone in the health system. Secondly, I think there was a very good discussion about trust. If we unpack trust, then all those skills which needed to address this manifestation of trust, probably the communication skills and effective communication skills are key. And this course provides those skills and those knowledge. So I think that also makes it very relevant for the different situation. And finally, I think one more thing, Naveen and colleague, is that there is a great shift in our thinking globally and regionally. We in last several years, there was a very serious focus only on developing countries. But I think now in last few years, this shift to also look into the dropouts and other issues related to immunization in middle income countries is also very key. And we are seeing growing evidence, which is telling us that the situation is not that good. And within new vaccines coming in, I think this whole issue of communicating and addressing the hard discussions and bringing the acceptance and trust back to immunization, I think this course and similar efforts are really very important and needed. And I really congratulate the team for all their great efforts. Thank you. Over.
Thank you. Dr. Hardeep Sandhu from CDC. Hardeep, you are muted. Unmute. Yeah.
Yes, yeah, it just took me a little time. So good morning, good afternoon, good evening, everyone. I had the pleasure to be a part of this initiative, particularly for the IPCI portion of this course. And it's been a good journey. And I think it was started at a time when, as mentioned before, it is vaccine hesitancy is one of the top 10 threats to the global health. And we have to take it seriously because it was not being addressed appropriately. It was being talked about, but talk is not action. So I think when we did IPCI program and developed modules, and then we were invited to join this collaboration with IPA to develop this training, I was very glad and happy to be part of it. So I congratulate it. It's been a journey, and I think it's come to a fruition now. And I'm so glad that there is so much interest in this project and in this course, that when folks will go through it, we would like to have the feedback and see how it's making an impact. But just to say that with the COVID pandemic coming in, we are seeing even more problems or more issues coming up around communication and health workers' confidence and trust or hesitancy towards the vaccine. Why I say health worker themselves? I think in the past, we have learned that if the health worker themselves are not confident and they are not prescribing, or their body language or the way they're saying that this to the mother, to the vaccination recipient, that this is a good vaccine, you should take it. If there is any amount of hesitancy, any degree of hesitancy among the health providers, it doesn't go well. And that's what we are even now seeing, that we have to take care of the health side, health worker side, or the delivery side of things. And that's what has come up now in some of the recent studies about COVID, that health workers are not really convinced. And currently I'm on this task force for vaccine in the US. And here also we are seeing the issue with the health worker having a hesitancy. So I think there are two-level issues: the delivery and the recipient service side, or the recipient side. But we have to tackle it, and I think this course will give the tools which has not been done yet systematically in the system. I believe that for this trust or this communication to happen properly, we have to have the communication experts, we have to have adult education experts, and we have to provide them with the content, which is the immunization content. So the three of them have to work together to make a package which can work. And I think this course has three of those. We have the communication specialists who can work on communication, they know it inside out, but they have to be given the right content to be packaged. And then you have to have the instructional designers, like this platform. Initially, we were thinking of using this as an in-person training, but over time it changed, and the instructional designers came in, and they advised the project how to make it in such a way so that how the adults learn and how the interactions happen. And of course, the immunization specialists involved in the project as advisors have been providing the right content for the training. So I think it has come up a long way, and I'm really glad that we are here now. We are finally going to see impact of this training. But congratulations to everybody involved, and I'm glad to be part of it. Oh.
Thank you so much, Hardeep. And I request Noni to unmute yourself. And she has been very, very supportive and always ready to contribute, eager to contribute, and give us a lot of suggestion. So yes, Hardeep, we have survived a very great, I will not say tough PAG, and incorporated all their suggestions in this course. So Noni, besides what you want to speak, there is a question about the COVID vaccines in pediatric patients. If you also can address that. Noni, please go ahead.
So let me do that one first. The COVID vaccine trials will be starting in children in the new year, and until most countries will not likely approve it, high, middle, or low income, until we have some of those trials data for each of the specific vaccines, should be starting in the new year. My comment would be, in Canada, we would not have enough vaccine to even start with children until the end of the first quarter, beginning of the second quarter. So it's not a rush issue because they are not at high risk for morbidity or mortality. There are many others who are in the front of the queue before them. We had a long conversation about that later if you want. I think the three things I wanted to raise about this, and they did come back in the chat. One is there is a ton, and it's an avalanche, and it keeps coming at us, of misinformation and disinformation around vaccines that has exploded, not just about the COVID vaccines, but everything about vaccines. And the trolls are out there, and the anti-vaxxers are out there loud and clear. And there's a couple of things that I wanted to emphasize for this. And Hardeep did one of them. Even among healthcare providers, I've seen healthcare providers perpetuate misinformation and disinformation because they didn't know it was misinformation and disinformation, but nor have we taught them well enough how to recognize and protect themselves against misinformation and disinformation. And that I would love to see another module added to this series of modules that's on it, because it's become desperate out there that this get done well. Second point is, one of the other pieces are, we need to understand from a communication point of view, because there is so much information out there, that some patients only want a bite. They want a simple answer to a complex question, and they don't want anything more. Don't confuse them with a ton more. They just want a bite of information. Others want the snack, and others want the full meal deal with the lunch. And we've not carved out how we've taught healthcare providers at the front line to deal with bites, snacks, and lunch, and we need to do that as well. And the third point, and it was raised in one of the Q&As, one of the chats, which I think is incredibly important. This is a huge opportunity with the COVID vaccines and the whole COVID piece, and the emphasis on why it's so important to have a vaccine for a pandemic or a disease where we could actually control it this way, to be able to change the future. So we need to be educating our children and our adolescents, because they are tomorrow's, on why this all joins up together and what they need to know about disinformation, misinformation, and the importance of vaccines in control of vaccine preventable diseases. And again, there are some education tools out there that are being used in some countries that I would love to see used all over the world. And thank you, Naveen.
Thank you, Noni. And may I request now two of the people who have been involved from very beginning, Dorothy, if you are still there, and Lois. Bella, I am coming to you after that. Dorothy, are you there? Lois, if not, maybe may I request Dr. Bruce Delling, if he is there, as our PAG members. Definitely he is leading the Sabin vaccine program. But Dr. Gallin, are you there? Okay. Then may I request Dr. Barbara Rath, if you are still there. I know it's 1.5 hours and most of the people have left. Barbara, are you there?
Yes, still here for a few minutes. Thank you so
please.
much for having us. Congratulations, this is a major milestone, not just for IPA and Sabin, but I think for pediatricians in different parts of the world. And it's just beautiful as a pediatrician myself to feel connected to this global alliance of goodwill and action, and agree that actions are what is needed in the next important steps. What we at the Vienna Vaccine Safety Initiative, which in itself is like a think tank of very different disciplines outside the medical field included, what we feel is really important here is to foster grassroots immunization, to have a good sense on the pulse of those people who are now starting to use your program, to see how it fits with the cultural and local environment, and trying to see how much flexibility can be given to make adjustments, but also keeping an open channel of communication backwards to the panelists and to everybody else at IPA and Sabin to see what people say when they start using this very helpful program. On the other hand, standardization of what we do is important, and the consistency of communication in this modern world, where parents may not just be living with their children in one country, but either working across countries or traveling throughout their lifetime. It's important to be consistent in our messaging and to be positive and constructive in order to solicit the trust, really, because just the perception of inconsistency in what people may hear from different providers may already be harmful to their overall level of trust. So I think that's a big part, I think, of this global effort, and I'm humbled by the outcome of this. This is phenomenal, and critical importance. We do some work in Europe on sort of helping clinicians, not only pediatricians, but with a strong focus, access vaccine education information. It's called the SECI project, Strengthening Education and Knowledge on Immunization, which is directed mostly to healthcare professionals at this stage. And we're very welcome to help amplify the very valuable content via this mechanism as well, with the European Academy of Pediatrics and others. So there's something called the Coalition for Vaccination at the European Commission level that is really a forum for all kinds of healthcare professional associations to find a common tune and a common understanding of vaccine and trust in immunization. So that's what we're happy to help with. Thank you.
Thank you so much, Barbara. And finally, I want to invite Laila and thank her. We were very particular that the voice over video record, what video lectures we have, the voiceover should be by the native people. And we found someone to do in Spanish, but it was very difficult to find in Russian. And then Leila came in and supported us, and her team has done all the voiceover of all the video lecture. So Leila, just for 1 minute, if you want to give any message, and thank you so much, you, Camilla, and the whole team for a wonderful job.
Thank you. I know that the people is tired, so I will be very short. First, I would like, of course, to congratulate IPA and you, Navin, personally, and all people who created this great course, and Sabin Institute for this initiative. Second, on behalf of the European Pediatric Association, the regional society, and of the Union of Pediatricians of Russia, I'm very grateful that we have these models at the same time in different languages, and not only in, for example, in English, French, German, and Spanish, but also in Turkish and Russian, which is great, and which means that something like 200,000 of my colleagues here in our part of the world, pediatricians, pediatric nurses, or other health workers who are working with children and to whom Russian language is more familiar than, for example, English or other foreign languages, could use these materials immediately together with other people in the world. So I would like to inform you that this job was done by the team of young pediatricians from my facility, and as a great mom of all these young doctors, I'm personally very honest that they did this great job. So thank for them, and thank you for this opportunity to do it for all. So let's start, and good luck for all of us. Thank you.
Thank you. And I can see Dorothy is here and unmuted herself. So Dorothy, you want to say a few words? You were the first person I talked about this course. Dorothy, are you there?
Thank you very much.
Yeah, please go ahead.
Dorothy, I really do want to congratulate you, Navin, because I am also quite humbled by what you've been able to do from our conversation about 2 years ago, and what has become of this, how you've been able to gather together the best brains in the world and all the main organizations involved in vaccine safety to be part of this project. I'm really in awe of what you have been able to achieve. Thank you very much. While saying this, it is really important that we also keep in mind that the whole idea of this is really to provide a template because there will be need to apply certain strategies based on the context of different countries. Like I do notice in the chat that somebody was concerned about being able to translate this into language that is outside of the 7 UN languages. Those are some of the areas that one would need to look into, and also to ensure that in the process of translation, we do not lose the meaning of what we're trying to achieve, so that, as was said earlier, we maintain a basic standard of information that is to be delivered. And also, I cannot but emphasize how critical vaccine hesitancy is to a demand for immunization, especially in countries such as mine. I come from Nigeria, where achieving the optimal routine immunization rate is still very much a challenge, even though it's improving in recent times. So being able to get this to the point where everyone understands the importance of vaccination, it is critical. And I do hope that as we go on, that this we will look also in including not just health workers, but being able to ensure that we're able, not just care providers, but being able that we're able to engage the members of government who actually, their words are also sometimes very critical to what is being propagated in the media as in recent times, you will see that major personalities in government have been the propagators of very deterring information on vaccines in the media. And so it is important that we also learn how to engage members of the government in ensuring that we tackle the issue of vaccine safety. Once again, I want to thank you all for being part of this. And I want to thank you, Naveen, for what you've done for our association, the International Pediatric Association. Thank you.
Thank you so much, Dorothy. And before I hand over to Vince for the final concluding remarks, I want to thank all PAG members, all faculty members, everyone who has Sabin Vaccine Institute, Sanofi Pasteur, Serum Institute, which has supported for Delhi training of trainer, and all the partners from WHO, Gavi, UNICEF, and everyone for supporting and developing this course, and particularly PAG members and the faculty, and also my colleagues in the standing committee of IPA and President Dr. Errol Eldon, who has been always very, very supportive of this. So over to you, Vince, for concluding remarks.
Thanks, Naveen. And I know that a lot of questions got answered, and really appreciate and thanks so much to the IPA team. You all have an amazing secretariat team who has done great work on this course and on all of the materials to support it. And so there were a lot of questions on, one, this course is free. Two, yes, it is focused on, it's focused for all health workers. I know that there was the discussion of frontline versus mid-level providers. I think there's different definitions of that, but we're really talking about anybody who is interacting with patients. There's so many skill sets that can be utilized here. And so we really want everybody to get involved. But to enroll in this, you go on the IPA Vaccine Trust Project. Right here is where you can sign up. And this is where the list of the modules and more information is there. And so I'm going to just put up one slide that has our contact information, as well as just a couple of things we want to do. I think that that we talked a lot about the communication skills that are needed. I think Nani really talked about at the end how much is going to be needed in terms of advocacy, especially over this next year with the COVID-19 vaccine rollout. And then also, just continuing to push for, we talked, the representative, Dr. Lara from Honduras, talked about the issues of routine immunizations there with being a challenge with the hurricanes. There's just so much that needs to be done here. But people are paying attention to vaccines right now, and we need to take advantage of that moment to advocate for it. And there's so much happening this year. The WHO has declared 2021 Year of the Health Worker and Health and Care Worker. In April, especially, there's World Health Day, World Health Worker Week, and World Immunization Week, all in April. So we're really looking for ideas as ways we can elevate frontline health worker voices. We're going to be doing video Q&As with health workers, with pediatricians and other health workers about the importance of vaccines. And then we also have this resource hub on immunizationadvocates.org that has a lot of resources, including a clinical course for health workers, and a lot of the resources that WHO, UNICEF, CDC, and others have. And so please check out immunizationadvocates.org. We'll be and let us know of additional resources that we can add to that. And so if you do have ideas or would like to partner with us, please do contact the IPA Secretariat. The email is there, and it's also in the chat, as well as the Sabin Vaccine Institute Immunization Advocates team. We will be back in touch, and we'll have additional seminars going forward. But we really, so this is just the launch of it. And we, as Angus was saying, I think we're really looking forward to seeing the feedback that we receive on this course. There are some suggestions for additional materials here. And so, you know, it's a work in progress. We need everybody working together, and really appreciate the partnership with IPA and all of the colleagues around the world and advisors who worked on this. We're very appreciative of it, and Sabin is happy to be just a small part of it. So thank you all. I think we took enough of your time for today, and we will send around the recording and additional information on this in follow-up. So thank you all for joining us today.
Thank you. And yeah, so yes, sir, Amy, you want to say something?
No, I just wanted to emphasize our thanks at Sabin for what we think is a great partnership with IPA, and we look forward to continuing that.
Thank you so much. Any other comments, Rob? Okay, and we will share the recording on our YouTube and with everyone, because around 1,000 people have registered for this course, but as it always happens due to one or other reason, and everyone has asked for recording, and we look forward that you will register for the course. And finally, I thank all my staff members, Shraddha, Amrita, Ankita, Deti, Lindsay, for their support. And we will see you again. Thank you so much.
Thank you, everyone. Bye.
Bye, everybody. Thanks.
Thanks very much. Bye-bye.
Thank you. Bye.
Thank you very much.